Connecticut is the first U.S. state to fully vaccinate more than half of all adults. But officials, of course, aren't stopping there. With hospitalization rates at their lowest in 6 months, attention is now on the remaining adults who are not vaccinated. NBC's Ellison Barber joins us now from Greenwich, Connecticut. Ellison, good morning. So how did Connecticut reach this vaccination milestone? Tell us about what they did right in their rollout.
Hey, Savannah. Yeah, so officials in this state say that they worked, the Department of Health here as well as the governor's office worked very closely with local health departments as well as hospitals. Some states, they had a centralized approach, if you will. They focused a lot on state-run mass vaccination sites. And if they worked with outside groups, they closely monitored that process, sometimes even imposing monetary penalties if the process was not followed to a T. Here in Connecticut, say they didn't impose any sort of penalties when working with outside providers to get this process rolling, and they say that worked in their favor. They also say the governor's decision to start with an age-based rollout proved really effective. That was controversial to start because you did have some people who were high risk that were a bit left out depending on where they fell in their age category, and that was criticized to start. But officials here say that ultimately what the decision to do age-based rollout did was it simplified the registration process and helped hospitals, vaccination sites get people in faster and just get more shots in arms. At this point, they say they're kind of shifting here from focusing on a lot of mass vaccination sites to more pop-up clinics going into specific neighborhoods. And they say that that is proving effective in recent weeks, but there's still a big hill to climb in terms of getting the rest of people who live here vaccinated. Savannah?
Yeah, so Ellison, is part of that hill to climb because of hesitancy? And if so, does the state have a plan for that?
Yeah, it is. They're seeing there's a kind of, I think the number that we got from the doctor we spoke to is about 30% of people who are just hesitant. But they basically say that right now they're kind of in the third phase of a vaccination wave, if you will, within this state. The first phase was having a lot of people want to get vaccinated, but not having enough vaccines to meet the demand. Second phase was still having demand and having enough vaccines to meet that demand. This third phase now, they say, is actually having enough vaccines and providers, but not having quite enough demand to use all that is available. Listen to some of what one doctor told us.
The last 50%, or the second 50%, is going to be tough. It's going to be tough for a couple of reasons. One is that, there are age groups right now below 16 that we can't give vaccine to until we get approval by the FDA. That's one. Two is that there is a substantial portion of the folks out there that haven't yet been vaccinated that are hesitant to get vaccinated. The final thing is of the 3 vaccines that are currently authorized for emergency use, since the pause of the J&J vaccine, we've seen a very low utilization of that vaccine.
He says the key with the J&J vaccine hesitancy is making sure that people understand how low the risk is for blood clots with that vaccine, but how much higher the risk of complications are if you were to contract COVID-19. Savannah?
Really important context, and it sounds like there are some lessons that can be learned from that state. Ellison, thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here. And click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.